Your life. Okay, hello. So now we're going to discuss yung neurodisorders. So I listed five neurodisorders that are common. So the first one is multiple sclerosis. The next one is the Guillain-Barré syndrome. Number two is the myasthenia gravis. Next one is trigeminal neuralgia, and last is Parkinson's disease. So usually, there is a keyword in order for you to know what the question is all about or what is the subject. So first, I'm going to discuss first the first in our list, which is the multiple sclerosis. So the definition of multiple sclerosis is the demyelination of the neuron caused by viral infection, an autoimmune disease that usually occurs between 20 to 40 years when you're 20 to 40 years old. So the famous celebrity that has multiple sclerosis is Selma Blair. So the precipitating factors for multiple sclerosis is pregnancy, fatigue, stress, injection, and trauma. The assessment is you have abnormal EEG, lumbar puncture, increased gamma globulin. It means you have an infection in the immune system. So, yan, gamma globulin. There's also fatigue, weakness, ataxia, vertigo, paresthesia, blurred vision, diplopia, nystagmus, decreased perception to touch, dysphagia. There's bladder distension, abnormal reflex. There's positive Babinski sign due to brain damage, emotional changes, and memory changes. So, in multiple sclerosis, you have to remember demyelination of the neuron. That is the keyword, demyelination of the neuron. So, for the intervention, you have to conserve energy. You have to do safety measures. You can also, for the diplopia, you can have an eye patch. You have to watch out for complications such as UTI, renal calculi, URTI, and yeah, URTI. And you also have to exercise to avoid stress. For medications, number one treatment is beta interferons, which reduces inflammation of the nerves. Beta interferons. And then also baclofen, which is a muscle relaxant, also used for it is also used for spinal cord injuries. Let's see. Baclofen. Maraming use ang baclofen. It's just for multiple sclerosis, spinal cord injuries. It's a muscle relaxant. And also glatiramer acetate. So that's the three medication. Beta interferons, baclofen, glatiramer acetate. So usually there's weakness. Yan din yung common denominator ng multiple sclerosis, GBS, and myasthenia gravis. So there's weakness in the three of them. While on trigeminal neuralgia, iba siya, it's pain. Pain in the trigeminal nerves. And then sa Parkinson's disease is a degenerative, it's muscle rigidity. Yeah. So multiple sclerosis, there's the demyelination of the neuron. The next one is GBS or Guillain-Barré. Hey Siri, what's the meaning of GBS?
Possible interpretations of GBS include Global Broadcast System.
That's wrong. Guillain-Barré syndrome. How do you pronounce that? How do you pronounce Guillain-Barré syndrome? Okay, anyway, so GBS is an infectious neuronitis of the cranial peripheral nerves, immune system. Yeah, of the it's an it's an immune disease that destroyed the myelin sheath. So that's the keyword, destroy the myelin sheath. On multiple sclerosis, the myelination of neurons. Ito naman sa GBS is destroy the myelin sheath. Okay, so your cranial preference. So the assessment is paresthesia. So yeah, paresthesia means there is loss of uh, feeling, of pain, decreased sensation, paresthesia. Pain or hypersensitivity. Okay, so sa hypersensitivity ng GBS, it is yung bed sheet. You can feel that. That's weight of the bed sheet. That's hypersensitivity. There's a low extremity weakness. There's a gradual progressive weakness of upper extremities. So ang GBS is ascending paralysis. First sa lower extremities, then it will eventually go up or ascend. So you will be alert for the respiratory syndrome, because usually if there's a respiratory signs in a patient with GBS, you have to be alert because it means that it's already ascending. So there's also presence of it's ascending, and it will lead to respiratory failure and death. So yeah, sa CSF niya, there's increased protein level. Yun ang makikita sa diagnostic ano niya. So for ganun din sa sa you can get the CSF through lumbar puncture. So for multiple sclerosis, ang makikita mo sa lumbar puncture is increased gamma globulin level. It means infection. You have immune disease. Okay. So the treatment intervention for GBS is pain management, and you have to monitor the respiratory status. And then for the medication, IVIG, immunoglobulin. Also, one of the interventions is plasmapheresis. Usually, plasmapheresis is a intervention for immune diseases such as lupus, SLE, because plasmapheresis is a process where you remove the antibodies that attacks the body. And also, physical therapy is also needed. Next is myasthenia gravis. Also, it's also characterized by weakness. So itong tatlong to, multiple sclerosis, GBS, and myasthenia gravis, the common denominator between these three diseases is weakness. So the definition is characterized by weakness, abnormal fatigue to voluntary muscle. Abnormal fatigue to voluntary muscle, there's a decrease secretion of acetylcholine. So this is the keyword for myasthenia gravis. That is acetylcholine. That's the keyword.
Hey, guess who just came by here? Who? Some guy. Hey, I didn't know him. He said, if you show me your boobs, I'll give you a bottle of wine. What? Who? Who did that? I don't know. He was just coming by. Oh my God. And he said that. So what happened? Did you call the police? No, he went that way. Well,
Okay. So that's the keyword for myasthenia gravis. Acetylcholine. What is acetylcholine? Acetylcholine is it's a neurotransmitter that is responsible for muscle contraction. Yeah. Okay. So yes, a neurotransmitter that is responsible for muscle contraction, and acetylcholine. It's under the nervous parasympathetic nervous system. Parasympathetic, yeah. It's a cholinergic. Acetylcholine is a cholinergic under cholinergic drug. So what's the assessment for myasthenia gravis? There's weakness and fatigue. There's difficulty in chewing and swallowing. There's ptosis or drooping of eyelids, diplopia, weak hoarse voice, and there's also respiratory paralysis. Intervention is you have to monitor swallowing and speech, suction as needed, watch out for myasthenic or cholinergic crisis. Yeah, because yeah, acetylcholine is under cholinergic. It's a type of cholinergic something like that. You have to also to avoid stress and yeah, avoid stress, and you have to take anticholinesterase medication. Anticholinesterase means um, it is the yeah anticholinesterase. These are the two anticholinesterase medication, edropomium and pyridostigmine. or Mestinon. Pyridostigmine is a long-term medication for myasthenia gravis, and the action of this medication is that it increases acetylcholine. While the first one, the edroponium, is usually it is used for diagnostic. It's a diagnostic tool um, to know whether you have myasthenia gravis or not. Well, this test, endoponium tensilon test, also known as tensilon test. This is actually an easy test, a simple test. So what you do is that and it also well, it differentiates also pala between myasthenia and cholinergic crisis. So myasthenic crisis, it means that there's an increase. Myasthenic cholinergic crisis. On myasthenic crisis, um, there's a decrease in acetylcholine. So yeah, so acetylcholine, myasthenia gravis, it is the decrease of acetylcholine. So that's the myasthenic crisis. So cholinergic naman is like the kabaliktaran of myasthenia gravis. So it means myasthenic crisis. It means it's the increase of acetylcholine siguro due to medication. So yeah, there's a cholinergic crisis. In myasthenic crisis, so there's a decrease in acetylcholine. The symptoms are it also somehow parang sa weakness din siya, decreased cough and swallow reflex, then there's positive incontinence. Pero ang vital sign niya is the vital sign is elevated. For cholinergic crisis, there's increased acetylcholine. So, ano ba ang acetylcholine? Acetylcholine is it is responsible for muscle contraction. So, the symptoms are abdominal cramps, there's muscle twitching, pupillary constriction, there's hypotension, um, there's blurred vision, pallor or paleness, nausea and vomiting, diarrhea. So what is the medication used for for the myasthenia gravis? So I mentioned the edroponium and the mestinon, and also atropine sulfate. Then atropine sulfate is also used for this disorder because it blocks the acetylcholine receptor. So sa tensilon test, okay, it differentiates between myasthenic crisis and cholinergic crisis. So what you do is you administer the edroponium. So if the patient shows improvement, meaning in his current state that you give the medication, the edroponium, if the patient is um, if the patient improves, it means that the patient has myasthenic crisis. But if you introduce the edroponium and the patient symptoms worsen, it means that the patient has cholinergic crisis. So positive tensilon test, it means that you have myasthenic crisis because you show improvement. Pag no improvement and the patient worsens, the condition of the person worsen, so that's a negative tensilon test. So let's just review the three neuro disorders that are somehow um, well, it's not related, but it's close to each other because first of all, there's weakness. That's the common denominator between the three of them. There's weakness, and yeah, and also there is a destruction of something. There's a destruction of myelin sheath for the GBS and demyelination of the neuron. Okay. Baclofen. Oh. No signs and symptoms. Okay. So the next one is trigeminal neuralgia. Trigeminal neuralgia is easy lang naman because it is the disorder of the fifth cranial nerve, which is the facial nerve. So there's a unilateral pain on the person's face, severe pain on the lips, gums, nose, and across the cheeks. That's a trigeminal neuralgia. So these are the stimulants that uh, stimulants that you have to watch out if a person has trigeminal neuralgia. So cold, washing face, chewing, extreme temperature, and sour and spicy food. So these are the stimulants that triggers trigeminal neuralgia. So for the intervention, you have to avoid the stimulants, avoid hot and cold, small frequent feedings. You have to chew food on the unaffected side. What are the medication? Carbamazepine. Carbamazepine is a relaxant, muscle relaxant. Baclofen, same as in the in multiple sclerosis. Baclofen, which is a muscle relaxant. Clonazepam, also muscle relaxant. Botox, it's yeah, Botox and gabapentin. Gabapentin is for neuropathic pain. Surgery. A patient with trigeminal neuralgia can undergo surgery then. Microvascular decompression, relocation of the artery that compresses the trigeminal nerve. Also rhizotomy, which is excision of the root of the nerve so that there will be no pain. Glycerol injection, it destroys the demyelinated fiber for pain relief also. And then, yeah, that's it. So let me just rhizotomy, microvascular decompression, glycerol injection. Yeah. Okay, so next naman is the Parkinson's disease. Parkinson's disease is a degenerative disease caused by depletion of the dopamine. So what's the keyword? What's the keyword with the trigeminal neuralgia? It's the face. That's the keyword because the facial nerve. That's the keyword. So Parkinson's disease, the keyword is that for you to understand the process, the pathophysiology of this disease is the keyword of Parkinson's is dopamine. Dopamine. So it is a degenerative disease caused by depletion. There's a decrease. All of these neuro disorder, there's a decrease in neurotransmitter. So for myasthenia gravis is the acetylcholine, for the Parkinson's disease is the dopamine. And the two, there are demyelination or destruction of myelin sheath, and then demyelination of neurons. So, if there's a depletion of dopamine, it interferes with the prevention of the excitatory muscle that causes mental deterioration. So, what are the assessment for Parkinson's disease? First one is bradykinesia, slow movement, sluggish mental response. There's akinesia, monotonous speech, pill rolling tremors. Pill rolling tremors are tremors on hand and fingers at rest. There's muscle rigidity, mask-like faces or a blank facial expression. It's shuffling gait. You have drooling. What is the intervention? The diet for this person is you have to increase the protein, increase protein diet, increase calorie. And usually then you have the soft diet. You have to increase oral fluid intake. Avoid prolonged sitting, lift feet when walking. Mhm. Hold the hand behind the back. So ito, these are anti-Parkinson medication. What do you have to remember this? Anti-Parkinson medication. First one is carbidopa. The other is levodopa. And the other one is cogentin. You have to avoid vitamin B6 and Mawis. Because Mawi, if anti-Parkinson disease, anti-Parkinson medication, taken with Mawis, this is private. So yes, this leads to hypertensive crisis. And then B6 then is B6 is cyanocobalamin. It blocks the effects of anti-Parkinson's medication. Hey Siri, what are the food rich in vitamin B6?
Okay, I found this on the web for what are the food rich in vitamin B6.
Mhm.
Check it out.
I will check it out. So these are the food. I know it's pyridoxine, sorry. Not cyanocobalamin, it's pyridoxine. Cyanocobalamin is vitamin B12. Food rich in vitamin B12 are animal products, meat, meat, eggs, like that. So vitamin B6 pyridoxine, number one is milk. That's rich in vitamin B6, ricotta cheese, salmon, tuna, eggs, chicken liver, beef, carrots, spinach, sweet potato, bananas, yeah, all of this. Okay, that's that's it. That's for the neurological disorder. Multiple. Let's review. So there are five common neurological disorder that are commonly asked in the Nclex. First one is multiple sclerosis. Number two is the GBS, Guillain-Barré syndrome. Myasthenia gravis, the third, trigeminal neuralgia, and the Parkinson's disease. So you have to remember that the keywords for you to know the disease, the pathophysia. So yung keyword na yon, it will enable you to know what's going on with the disease. So for multiple sclerosis, there's demyelination of neurons. So if there's a demyelination of neurons, of course, there's weakness. For GBS, there's the myelin sheath also is also destroyed. So there's panesthesia and weakness also, low extremity weakness. For myasthenia gravis, the keyword is acetylcholine, which is responsible for muscle contraction. There's a decrease in acetylcholine. So there's weakness also in myasthenia gravis. And then for trigeminal neuralgia, the keyword is facial nerve. So facial nerve, it means there's pain on the facial nerve, trigeminal nerve actually. And then for the Parkinson's dopamine, there's a decrease in dopamine. So dopamine is a neurotransmitter that uh, it uh, it interferes with the prevention of excitatory impulse. So Parkinson's disease, there's tremors. Okay, the next topic would be tumor lysis syndrome. So tumor lysis syndrome, these are kidney injury due to nucleic acid converted to uric acid. Because of kidney injury, the nucleic acid is converted to uric acid. So you can also get tumor lysis syndrome when there is initiation of cytotoxic chemotherapy. So that will that is the cause of risk factors for tumor lysis syndrome. There's kidney injury and there's initiation of cytotoxic chemotherapy. Okay, so for there is the electrolyte abnormalities for tumor lysis syndrome. There's increased uric acid because of the kidney injury nga. So the nucleic acid are converted to uric acid. So there's circulating uric acid in the blood. So there's a increased uric acid. Also, there's an increased phosphorus and increased potassium because there's kidney injury. Pag may kidney injury, um, potassium and phosphorus will not be secreted. So there's an increase phosphorus and potassium. Also, calcium, there will be a decrease in calcium because if there's an increased phosphorus, there's an decreased calcium. You have to monitor for the electrolyte imbalance, you have to monitor the electrolytes and also telemetry because these electrolytes causes dysrhythmias like potassium causes cardiac dysrhythmias and also decrease in hypocalcemia. It also causes dysrhythmias and tetany. Okay, so for tumor lysis syndrome, you will also give allopurinol because of increased uric acid. Okay, so what are the treatment for tumor lysis? The first one is well, actually, treatment. Yeah, you can give phosphate binders, sevelamer, lanthanum carbonate, and calcium acetate. Sevelamer in wait, this sevelamer. Sevelamer is it is used to lower the phosphorus level of the blood. That's sevelamer. Is that a phosphate? Yeah, it's a phosphate binder. Okay. So we're now going to go to pediatric digestive system disorder. This is also common. We always see this questions in the Nclex, this pediatric digestive disorder. So this there are five actually. Oh no, we'll make it 1, 2, 3, 4, 5, 6, 7. But these are easy. These are easy pediatric digestive system disorders. Before I am confused with this, very confused with this. But as I go along, as I always study, I study continuously and answer questions. I always encounter these types of questions. So parang nasanay na rin ako na ito, laging ito yung tinatanong. So, naging na-familiarize ako sa kanila isa-isa. So, yeah. Madali lang to. The first one is the celiac disease. So, there are 7. Celiac disease is the first. The second one is Hirschsprung. The third is intussusception. The fourth one is pyloric stenosis. The fifth one is esophageal atresia, tracheoesophageal fistula. Next one is cystic fibrosis. And last one is pahabol lang to, lactose intolerance. So, may mga ano rin to. Meron din itong mga keywords like in neuro disorder. There are keywords that you have to remember for you to know the disease. And if you know the disease, you can answer the questions. So, the first one is celiac disease. What is the keyword for this disorder? The keyword is gluten. Gluten. So it means that celiac disease is an intolerance, a disorder that is um, uh, characterized by intolerance to gluten. So what are gluten? Gluten are these are foods that contain brow, B-R-O-W, barley, rye, oat, wheat. Okay. So, celiac disease is a digestive disorder. So ano ang kanyang mga assessment? Also, digestive ang kanyang mga ang kanyang mga assessment. First one, you have diarrhea, there's anorexia, vomiting, steatorrhea or fatty stools, because there is steatorrhea because there's also an absorption problem with celiac disease. Next one is muscle wasting in the buttocks and the extremities. So, what are the nursing consideration that you have to remember? So, for newborn, 3 to 6 months after the symptoms occur. And then due to the accumulation of glutamine, it is toxic to interstitial mucosa. This is so yeah. So it also one of the characteristic of celiac disease also is there's an accumulation of glutamine. But the one that you have to remember is yung gluten. Foods. So the Nclex will not give you ask you for questions that is barley, ganun kung what are the foods to avoid. They will not give barley or rye or oat or wheat. It's they will test your knowledge if you know the foods that contain this gluten. So you have to avoid commercially prepared ice cream. Yes. And you have to avoid malt because malt like Milo ganun alam ko may yun eh, there's wheat, tapos puddings and grains, bread rolls, cookies, lahat ng wheat as flour, cakes, crackers, cereals, spaghetti, because spaghetti may pasta siya, it is made of flour or wheat, macaroni noodles, beer and ale. Foods allowed. Everything that's not mentioned is allowed. So meats, dairy product, veggies, fruits, rice, cornflakes, cornmeal, rice. Okay. Next one is Hirschsprung's disease. Hirschsprung. So for Hirschsprung disease, what is the so the keyword is the absence of ganglion cells. Ganglion cells. Oh. Ganglion cells. Okay. So ang tatandahan mo lang sa Hirschsprung is that ang may problema sa tandahan mo lang sa Hirschsprung is that ang may problema sa kanya is on the rectum. there's an absence of ganglion cells in the rectum intestine. So, yun. What is ganglion cells ba? Ganglion cells are, these are responsible for the movement of the bowel. Parang siya yung ganglion cells are like they are responsible for the movement of the bowel that move the stool through the intestine. So, isipin mo kung walang ganglion cell, hindi ma-move ng intestine yung yung mga food. And usually nasa may part ng rectum siya. So, what are the assessment? Of course, ito ang kanyang pinaka sign is ribbon-like foul-smelling stool. Because ano bang itsura ng kasi? Ano ang itsura ng Hirschsprung's disease? Hey Siri, can you show me the picture of Hirschsprung disease?
Any matches in your photos library?
Ano ba yun? Ba't
Here
yun?
are some images from the web.
Ay naku, bulok ka Siri. Hirschsprung disease. Hirschsprung disease. Hirschsprung. Okay. So the rectum is shrunken. Look. Oh no. Look. So this is the normal rectum. And this is the abnormal rectum. So parang inflamed siya and shrunken because of the absence of ganglion cells that it's responsible for the movement of the intestine that allows the stool to move through the intestine. So there's a ribbon-like stool. Ribbon-like stool. Okay. Okay. So that's ribbon-like stool. Oh, ano what? Failure to pass meconium sa newborn. Paano makakapag-pass ng meconium in a newborn? The rectum is shrinked. Okay. The newborn refused to suck. There's abdominal distension. And there's bile-stained vomitus. Bile-stained vomitus is present because kasi yung obstruction mo is on the intestine. So ang intestine it is much lower. Yung much lower siya. So nasaan ba ang bile? Bile is secreted by the liver. Is it? Bile. The bile or is a dark yellowish group produced by the liver. Okay? But it is stored in the gallbladder. So ano ba ang position niyan? Okay. Bile-stained vomitus. So, pag may bile-stained vomit, Uh-huh. In here's from here's from. Mhm. Okay, so there's bilious vomiting if there's an intestinal obstruction. And clearly, Hirschsprung is an intestinal obstruction. So, meron siyang bilious vomiting. Okay. The patient or the child will have failure to thrive, and there will be constipation and diarrhea. So for the what is the intervention for Hirschsprung? So of course you have low fiber dapat because you don't want the bowel to be irritated. So there should be low fiber and you have to increase the protein and the calorie because the patient will be severely malnourished here because of the intestinal obstruction. So low fiber lang. Then also you have to have stool softener and rectal irrigation. But for the surgical, we handle, I mean, an OR nurse, and we handle patients with Hirschsprung disease. And what they do is that they cut a portion of the bowel that is affected, and then they pull it and they suture it in the anus. So that's what you call a pull-through procedure. You can also have temporary colostomy, but mostly they do this pull-through procedure. The Hirschsprung. So sa Hirschsprung, madali lang Hirschsprung. You will only you have to remember yun nga yung there is a shrunken anus or rectum because there's absence of ganglionic cells that is responsible for the movement of stool in the intestine. So, ano nalalaman mo na dun? From there, you will know na kung ano yung mga symptoms na pwedeng maano niya. There's vomiting, intestinal obstruction. So, yeah, there's vomiting, ribbon-like stool, kasi nga shrunken yung rectum. There's abdominal distension, like that. And then next is intussusception. What is the keyword for intussusception? Telescoping. Into T. Telescoping. Intussusception of one portion of the bowel. So, telescoping of one portion of the bowel. So, from this, you will know the assessment for the patient. The first, you will have currant jelly-like stool. It comprises of stool, blood, and mucus. The second one is colicky abdominal pain because ikaw ba naman mag-telescope ang bowel mo? Masakit talaga yan. Colicky abdominal pain. There is vomiting of gastric content because there is a presence of intestinal obstruction, which is the intussusception nga. You will also have bile-stained emesis. Because there's intestinal obstruction, you have bile-stained emesis. And also, you have sausage-shaped mass. So, maraming sa mga x-ray, for intussusception, you have sausage-shaped mass. For pyloric and stenosis, you have olive shape. So, kayo malilito dito, telescoping. Imagine, this is the bowel, two bowel, they will telescope. So, mas lalaki siya kasi parang ano sila, natiklop, na fold yung bowel. So malaki siya. So that will be the sausage shaped mass on the X-ray. Right upper quadrant. Right upper quadrant. Right upper. And then there will be abdominal distension because of the intestinal obstruction. What is the intervention? You have to decompress by NGT, hydrostatic reduction. Yeah, that's it. And surgery. No. Sometimes, yeah, that hydrostatic reduction, you can do that. You can do that using water. Mm-hmm. The next one is pyloric stenosis. This is also an obstruction. So pylorus is the muscle between the stomach and the intestine. What is the keyword here? It is the keyword is pylorus. And you have to know what is pylorus. Pylorus is the muscle between the stomach and the intestine. Stomach and then the intestine. So there's hypertrophy of the muscle of the pylorus, narrowing the pyloric canal between the stomach and the duodenum. It is developed in the few weeks of life, 0 to 6 months. So alam mo na, from the keyword pylorus, which is the muscle between the stomach and the intestine, there's narrowing of the pylorus. So, for the assessment, you have projectile vomiting of mucus and blood. There's also dehydration and metabolic alkalosis. Why metabolic alkalosis? It's because of the vomiting. There's also visible peristaltic wave that occurs right after feeding. So for the X-ray, you will see an olive-shaped mass. That is the pylorus. Maliit lang ang pylorus. So intervention, surgical pyloromyotomy. It is the incision of the muscle fiber of the pylorus via laparoscopy. That's it. That's pyloric stenosis. Next one, we have, pediatric, ano lang bang diniscuss ko? Naka 1 hour na. Next one is esophageal atresia, TEF. Tracheoesophageal fistula. We also handle this in the OR. So, dali lang din to eh. It's easy. Esophageal atresia, tracheoesophageal fistula. So means, what does atresia means? Atresia means there's close or absent of. So dito, esophageal atresia, yung esophagus, stomach. Walang connection. Bigla na lang siyang nawala. So, walang connection ng esophagus at ang stomach. So yun nga, esophagus terminates where it reaches the stomach, ending in a blind pouch or fistula. What is a fistula? Fistula forms a connection with the trachea. So ayun ang mangyayari. Magkadikit lang kasi ang esophagus and the trachea. Esophagus is for digestive, trachea is for respiratory. So if there's fistula, it's a connection. So yun nga, ang mangyayari dyan, the patient can have aspiration pneumonia and respiratory distress syndrome. So what are the assessment? Frothy saliva and excessive drooling. Because yun nga, may fistula, may air doon sa esophagus. After feeding, you will have respiratory distress syndrome. We have 3 C's yung sa assessment. 3 C's of EA-TEF. We have cyanosis, choking, and coughing. Three C's. Cyanosis, coughing, and choking. Intervention. But how do you? Okay. The intervention is you keep the blind pouch empty. Okay, that's pre-op, and then always the patient should always be in an upright position. You keep the gastrostomy tube open so air can escape and prevent regurgitation. Post-op, gastrostomy tube is attached to gravity drainage until the feeding is tolerated. Then before feeding, you have to elevate the gastric tube before ano ito? Bago mag-feed, you have to elevate the gastric tube above the stomach for air to pass. Okay. Dapat attached to gravity drainage before feeding, when the feeding is still not tolerated, and then before feeding, you have to elevate. That's it. So, peptic ulcer and duodenal ulcer. Actually, ilito pa rin ako dito sa peptic ulcer and duodenal ulcer. But let's try to discuss this. So, peptic ulcer versus duodenal ulcer. Peptic ulcer is a sore on the lining of the stomach, while duodenal ulcer is a kind of peptic ulcer that develops in the duodenum. Duodenum. Where is the duodenum located? Uh, Duodenum is located at, it is the last part before you enter the intestine. That's what I know. Duodenum. 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 Ano ba kayo, Siri at Google Assistant? Wala kayong assistant. Okay, duodenum is the first part of the small intestine because the first one is ileum, jejunum. That's what I know. Ileum, jejunum, duodenum. Am I right? It's the first part of the intestine. It's located in the stomach and between the stomach and the middle part of the small intestine. Jejunum. Jejunum, ileum. Yan. So tama, okay. DJI pala, sorry. DJI. Duodenum nga yung start na ng ano yan, small intestine. Jejunum. Jejunum. Yan. And the ileum. Lower part. Middle part of the intestine. Ileum is the last part. DJI. Okay. So, let's compare peptic and duodenal ulcer. So, for peptic, there is a decreased secretion, gastric secretion. While on duodenal, there's an increased gastric secretion. In peptic ulcer, there's a 3-drug therapy: omeprazole, amoxicillin, and clarithromycin. Clarithromycin. And then, sa food naman, peptic ulcer are not relieved by food. Not relieved by food. While duodenal ulcer is relieved by food. Weight gain is present on duodenal ulcer because it is relieved by food, so the person tends to eat para mawala yung pain. And it usually, the pain occurs between meals, after meals, during nighttime. That's the duodenal ulcer. And yeah, duodenal ulcer is common sa mga bata pa 35 to 40, while peptic ulcer is 50 to 60 years old. There's a presence of epigastric pain, but it occurs 1 to 2 hours, while epigastric pain sa duodenal ulcer is 2 to 5 hours. And peptic ulcer is caused by H. pylori. So yun, that's what you have to do. There's no gastric secretion, decreased gastric secretion. Pero sa duodenal, there's decrease. So not relieved by food ang peptic, duodenal relieved by food. Okay. So, i-review lang ulit natin yung i-review lang natin yung osteo and rheumatoid. So, the difference in osteoarthritis and rheumatoid. Rheumatoid are autoimmune, and then osteoarthritis is mechanical wear and tear, maybe due to obesity, tsaka wear and tear. The runners usually have this osteoarthritis. So, saan common yung osteoarthritis? It is common sa mga weight-bearing hands, knees, hips, and spine, and also fingers. While rheumatoid arthritis, it's in the joints. Rheumatoid sa shoulders, sa fingers, sa large joints usually. Okay. Osteoarthritis is, so common siya sa hands. Osteoarthritis, nice, spine. Ang rheumatoid, common siya sa cervical spine. Osteoarthritis, it's asymmetrical. So one part lang ang meron usually nagkakaroon. So pag may nararamdaman kang pain, parang arthritic pain in the hands or the knees, usually unilateral lang siya, one side. And then for rheumatoid arthritis, is asymmetrical. Treatment, both heat. Heat ang treatment. So both osteoarthritis, splints, braces, and NSAIDs. While on rheumatoid, frequent ROM and rest. Ang common problem din sa rheumatoid arthritis is morning joint stiffness. That occurs 60 minutes to basta morning joint stiffness, it's common in rheumatoid arthritis. Tapos ang osteoarthritis, morning stiffness din. Low back pain. That's ankylosing spondylitis. Hey Siri, what is ankylosing spondylitis?
Ankylosing spondylitis is a type of arthritis in which there is a long-term inflammation of the joints of the spine.
Joints of the spine.
Want to hear more?
Yes.
Typically, the joints where the spine joins the pelvis are also affected. Occasionally, other joints such as the shoulders or hips are involved. Eye and bowel problems may also occur. Back pain is a characteristic symptom of OAS, and it often comes and goes. Stiffness of the affected joints generally worsens over time.
Okay. Thank you. So for the last topic, leukemia. Leukemia. So there are two types of leukemia, the myeloid and lymphocytic leukemia. Each one also has two kinds, acute and chronic myeloid leukemia and acute and chronic lymphocytic leukemia. So what is myeloid? Actually, nalilito ako dito. Nakakalito ang explanation. Let's just tackle each one of them. So the most common leukemia in adult is the AML, acute myeloid leukemia. You have to remember also that in leukemia, mas fatal ang chronic because not fatal but mas mas hard to treat because the symptoms usually occurs when in the late stages na, because chronic nga, hindi agad matagal yung process, it's chronic. So yeah, na late na siya na ma-determine. So mahirap na siyang gamutin. So acute myeloid, this is common in adults, while chronic myeloid leukemia, it affects mainly adult then. Okay. So sa lymphocytic, acute lymphocytic leukemia, it is common in young children. And chronic lymphocytic leukemia, it is most chronic. This is the most chronic adult leukemia. Kaya ngayon nga, you may feel well without any treatment for years. So, what's the difference of myeloid and lymphocytic? So, lymphocytic, it affects the lymphocytes located in the WBC, while sa myeloid, starts early in the myeloid cell. Myeloid cells are cells that myeloid are cells that becomes WBC, platelets, and RBC. Ang lymphocytes naman, yung mga T cells, sigurado. Basta lymphocytes yung nagfa-fight ng infection, yun na yun. Huwag nyo na akong tignan mo nga mata ko, Mauro, nasakitan na ulo ko, kakatingin, dalawang screen ko. Anyway, so let's just na lang, yung mga common. Kung ano ba dito yung fatal, ano yung nagagamot. Okay. So yun nga, acute myeloid, common in adults siya. Ang lymphocytic, common in acute lymphocytic, common in young children. So, risk factor, smoking, genetics, chemotherapeutic drugs, radiations, and also benzene. Benzene are found in paints. Risk factor sa chronic myeloid, ganun din, is the same. For the signs and symptoms, you will usually this involves sa blood siya. So myeloid, myeloid cell eventually becomes WBC, platelet, and RBC. So there's fever, fatigue, weight loss, headache, petechiae, swollen gums, and swollen liver, spleen. The diagnosis for this is X-ray, bone marrow test, spinal tap. Yeah. Okay. So what are the factors? Age older than 60. What are the prognostic factor? For chronic, age older than 60 years old for the chronic myeloid. Enlarged spleen, very high platelet count. So, what are the treatment? Chemo, radiation, stem cell transplant, and then consolidation therapy. Yan. Bone marrow transplant. That's the treatment for the leukemia. And then the fact for this is that it can be cured. Acute myeloid, it can be cured. So, sa children, maganda ang survival rate niya eh. Nag-improve na siya. Acute myeloid. It is common in adult but also nagkakaroon din naman ng children nito. But for children, the survival rate has improved. While for older patients, it's very disappointing. Now, sa lymphocytic, acute lymphocytic, ALL, there's bone pain, fever, ganun, may bleeding, shortness of breath, pale skin, weakness, frequent infection. Because nga, lymphocytes fights the infection. Fact, treatment is typically successful. Yan. So, ito yung mga nakikita nyo na may blood, nakakaawa talaga. So, the fight lasts for 2 to 3 years. And then the first months are the hardest. Next one is a chronic lymphocytic. This is the most chronic. Maybe the worst because yun nga. No, not the worst, but most chronic because you can have the disease, but this is asymptomatic, and you may feel well for years without treatment. Okay. So that's it. That's for the index card of medical surgical. I hope I learned something. What's the next? So I'm done with the anapisio. Maybe I'll just rest for a while and then I'll do OB, obstetrics, because ito ang hirap ako sa NPedia. So, thank you for watching. Have a nice day. Bye.